As a mother myself, I think how easily I could have died on the 23rd of January 1984 when I suffered postpartum hemorrhage. I was only fortunate to be attended to by a qualified doctor.
162,000. That's the number of women who died from complications related to childbirth and pregnancy in Africa in 2010. And this uninviting figure is just the start. Some of these babies won't make it out of the starting blocks. Close to 900,000 of them are stillborn. Over 1 million will die before they are a month old. And another staggering figure, well over 2,200,000 children will die before their 5th birthday. Yet there are many low-cost interventions and strategies which could prevent this ongoing tragedy. In some countries, substantial progress has been made in terms of mother and child mortality. The 2006 adoption of the Maputo Plan of Action and the launch of the campaign on accelerated reduction of maternal mortality in Africa in 2009 have done much to improve the situation. But it is still not enough. With the 2015 deadline for achieving the Millennium Development Goals looming large, there's an urgent need to intensify action to reduce the number of mothers, babies, and toddlers that die unnecessarily each year.
Well, the record is clear that unless we can improve upon maternal health and family planning interventions, we will not be able to achieve Africa's economic growth.
The 5 major killers of children under the age of 5 are preterm birth complications, birth asphyxia, pneumonia, diarrheal diseases, and AIDS. While some aspects of prevention or intervention may be complicated and costly, there are other alternatives that are so simple. For example, ensuring that babies have access to basic vaccinations, the early diagnosis and treatment of pneumonia, and prevention of mother-to-child transmission of HIV. Globally, over 1.5 million children die each year from vaccine-preventable diseases. In Africa, while 207 million children have been immunized since 2000, projections suggest that an additional 95 million will need vaccinations by 2015. Bringing a baby into the world should be a magical moment for any woman. But if no aid has been given to the mother to ensure that she receives enough sustenance and at least basic antenatal care, if the birth takes place without skilled assistance and in unhygienic conditions, if the young mother is left on her own without medical help for her and her child, and no one to advise her on how to feed and care for her baby properly, then, instead of being something wondrous, giving birth could be a traumatic event.
It is of critical importance for the African Union to prioritize women and child health. Discussing the matter at this highest level of African leadership indicates the seriousness with which Africa regards women's health and their well-being.
No woman should die giving life, and children should have a chance of a happy, healthy future. Governments need to focus more not only on the prevention of maternal and child mortality, but also on maternal morbidity. Improvement in healthcare systems, provision of low-cost or free family planning services, community outreach projects, and public-private partnerships for the provision of modern technologies are just some of the steps that should be taken. The impact of a government's intervention will extend far beyond the individual, ultimately benefiting the country as a whole.
Let us keep mothers alive. I'm responsible. You are responsible. Africa and the world are taking responsibility.
Let us make it our dream and goals to work together and achieve a brighter tomorrow.
If you're in North Africa, run to the nearest hospital. If you're in South Africa, check